Hi, Dr. Punyashri.
Yeah.
So, we know that of all the Gynaec cancers, ovarian cancer is the most lethal, and usually patients come to us in the late stages because they don't know that they had ovarian cancer. As a gynec oncologist who has seen so many cancers of the ovary, what would be your advice? Which subtle signs or symptoms and tests which a patient can do with family history, without family history, with risk factors, without risk factors, to pick up a cancer of the ovary?
So, ovarian cancer, yes, it's a very fatal gynecological cancers because it's of course picked up in the advanced stage and the mortality rates are very high. The overall 5-year survival is around 20 to 30%, considering that it's picked up in the advanced stages. So, ovarian cancer has very, very vague symptoms. Like the most common symptom that patients come with is probably bloating, early satiety, that they feel full even after eating a little, and loss of appetite, mild pain, vague gastritis. All of these are the initial symptoms that people usually have months together, but they wouldn't have had a check for it. And eventually it becomes to a stage wherein the abdomen bloats and they would have bowel symptoms, constipation, pelvic pain, lower back pain, or menstrual irregularities, or a mass in the abdomen. So those are the advanced symptoms that they would have in the advanced stages. So I would suggest that if patients are having these bloating, gastritis, indigestion, symptoms for lasting for more than 2 weeks, in spite of taking the basic medicines which usually people start off with over the counter. So in spite of that, if they do have symptoms, they definitely have to get it evaluated by an expert. That is one thing. Of course, there is no screening test for ovarian cancers as of now, like how we have for few other cancers. But there are certain things that can reduce the risk of ovarian cancer. The main risk factor for ovarian cancers is the age. So age more than 60 years. And being a female is a risk factor because you have the ovaries. So, and also family history. The 15 to 20% of the ovarian cancers are familial. So you should know your history, family history of any breast cancer, ovarian cancer, any endometrial cancers or prostate cancer, even in males, and pancreatic cancer. These are the things that you should know about yourself. Like maybe the first degree relatives, second degree relatives, anybody had these cancers, at what age they had it. All of these are the information that everybody should have. And also the risk factors like never being pregnant, not breastfeeding, all of these are also risk factors for ovarian cancers. So there is no screening test, so that's why it's not picked up early. So if you have any of these symptoms, get evaluated is what I would say. And also to prevent, not to prevent, but to reduce the risk, of course, we have seen that oral contraceptive pills usage for more than 5 years have reduced the risk of ovarian cancers by 50%. Breastfeeding for more than 1 year. And pregnancy is a good risk reducing factor. Apart from that, at least regular health check every year. Maybe get a ultrasound in the health check just to check on the status of the ovaries. All of these are certain things that we can do to reduce the risk.
Thank you.